we are discussing smoking cessations. So as we all know, smoking contributes to COPD by increasing annual rate of decline in FEV1. FEV1 decreases annually in every individual. In non-smokers, if the person is not smoking, and about smokers, in not smokers, the decline in FEV1 is about 30 milliliter per year. So in 1 year, there is 30 ml decline in FEV1 for a patient or for an individual who is non-smoker. But for a smoker, there will be around 70 ml of FEV1 will decrease in a year. So the smoking is responsible for such a huge decline. In FEV1 in patients. So why we should continue smoking? There is no need to continue smoking. So we are that we required counseling. Counseling the patient is very important. You have to counsel the patient to stop smoking. Patient should be advised smoking cessation at every visit. Even 3 minutes of counseling can result in about 5 to 10% of smoking cessation. The practice of delivering smoking cessation support should follow principles of 5 A's. Important 5 A's. Should not forget 5 A's. Now 5 A's, first one is ask the patient. Ask, that is ask. Ask the patient about their tobacco use. Ask the patient about their tobacco use. Second is advise the patient. Advise the patient to quit smoking. Third most important is assess. Assess the willingness of the patient to quit smoking. Fourth one is assist. Assist means it's about a quitting plan. Quitting plan. You have to make a plan and assist the patient to quit the smoking. The fifth one is arrange. Arrange for follow-up contact. So these are the 5 A's that we should remember in counseling a patient: ask, advise, assess, assist, and arrange. This is a non-pharmacological way of treating the patient in cessation of smoking. Then we come to the pharmacological method of coming to the pharmacological treatment method in treating smoking or cessation of smoking. First one is nicotine replacement therapy, that is NRT. That is the first modality, first treatment modality for those patients who requires smoking or a cigarette within 30 minutes of waking up from the bed. Within the 30 minutes of waking up from the bed, if the patient requires a cigarette, we prefer a nicotine replacement therapy as the first treatment modality. So how is it available? So it is available as lozenges. It is available as a nasal spray. It is available as gum. It is available as transdermal patch. So these are the four major things in which the different variety in which this nicotine replacement therapy is available. So mostly we use gums as the first line because it is very easy to get availability. So you see nicotine mist, this is nicotine spray. So it's suitable for smokers and vapors. Nicotine transdermal patch by Cipla, helping. So how this nicotine is given? The nicotine gum is given as 2 milligram every 1 to 2 hours for those who are smoking less than 24 cigarettes per day. So if a patient is smoking less than 24 cigarettes per day, if he is smoking less than 24 cigarettes per day, then we can give a nicotine gum of 2 milligram every 1 to 2 hours. So for every 1 to 2 hours, we can give a nicotine gum, a chewing gum, for those patients who are smoking less than 24 cigarettes per day. So one gum can be chewed for about 30 minutes. Okay, one gum can be chewed for about 30 minutes. Next, you see, if a patient is taking more than 24 cigarettes per day, or less than, let me tell you, 25 cigarettes per day, more than 25 cigarettes per day, more than or equal to 25 cigarettes per day, then you can give about 4 milligram of nicotine every 1 to 2 hours. 4 milligram of nicotine every 1 to 2 hours. If it was less than 24, we can give 2 milligram every 1 to 2 hours. If it is more than 25 cigarettes, we can give 4 milligram every 1 to 2 hours. So the duration of therapy is about 3 to 6 months. 3 to 6 months is ideally required for the person to quit smoking. So along with this NRT, you require counseling. Okay, otherwise we cannot completely cure this. So these are supportive measures. How to use a nicotine gum, that's very important. Chew the gum, and after chewing it, sometimes when the taste comes, you put the nicotine gum between the after putting it in between the cheeks. When the taste fade away, you again bring it back to the teeth and start chewing. So chew it for 30 minutes. Okay, method is called park and chew. Park and chew, parking in the gums and then returning back to teeth and chew. That is park and chew method. The medications which mimic nicotine is first one is bupropion sustained release. Neuronal uptake of blocks the neuronal uptake of dopamine and noradrenaline. It blocks the neuronal uptake of dopamine and noradrenaline. So more amount of dopamine and noradrenaline will be available at the neurotransmitter junction, that is the neuroreceptor junction. So it creates a feeling of nicotine. So the dose that we give is 150 milligram is given OD for 3 days. First 3 days we give 150 milligram of bupropion for 3 days. Then it is followed by 150 milligram BD for up to 6 months. So 150 milligram OD for 3 days followed by 150 milligram BD for 6 months. The side effects of this bupropion is insomnia, and it should be avoided in seizures. So bupropion should be avoided in seizures and in patients who suffer insomnia. Then the second one is the most advanced one of the is the Varenicline. Varenicline. Varenicline is the second most drug, is one of the advanced drug which are using in treatment of smoking cessation. So, acetylcholine receptor partial agonist. So, it is a partial agonist. Acetylcholine nicotine receptor partial agonist. So, it will create a similar effect like what we get in smoking. So, this drug uh, nicotine withdrawal. So, what's the dose about? The dose is about 0.5 milligram OD for 3 days. Then it is followed by 0.5 milligram BD for 4 to 7 days. Then it is followed by 1 milligram BD for from 8th day up to 12 week. Okay, from 8th day up to 12th week, up to 12 week. So it is 0.5 OD for 3 days, 0.5 BD for next 4 days. From 8th day it is 1 milligram BD for next up to 12 weeks. That is 12 divided by 4 is 3 months duration. In the nicotine replacement therapy, we should first stop smoking, then only we can start nicotine replacement therapy. But about for these medications like bupropion, and varenicline, we can start 1 week. We can start this drug 1 week prior to stopping this smoking. Okay. Then most of the patient responds to varenicline than bupropion or nicotine replacement therapy. This nicotine replacement therapy plus bupropion may be used together, can be used together. Okay, less side effects, but with nicotine replacement therapy and varenicline, more side effects. Some other drugs are clonidine and nortriptyline. Okay, so this is only about this smoking cessation, and I hope you have understood this smoking cessation. And let's work forward, treat the patient. All the best. Thank you for listening.